High blood pressure, big risk for heart attack. We covered that pretty well. It's also a big risk for stroke. Big, big risk. If you want to reduce your risk of stroke, this is the way to do it. Unfortunately, Oregon has a high incidence of stroke. If you imagine the United States and you look at the southeast part of the United States and color it purple in your mind, everything's purple down there, big stroke incidence in the southeast, but up in the northwest, deep purple. We don't know why. I can blame the rain because I'm from Alaska. And even when it was dark out, we were playing outside in the dark, building igloos, playing with flashlights. But in Oregon, you just don't do that in the rain very much. Anyway, we have a higher incidence of stroke. And let me just tell you a little bit about stroke. About 87% of strokes are from a clot being flicked up from the heart. Have you all heard of atrial fibrillation? Just see if I can do this without dropping this. If you imagine your heart chambers on the bottom and your heart chambers, the atria on the top, they should squeeze, then these squeeze, and they're supposed to play nice together. Lub-dub, lub-dub, lub-dub. But in atrial fibrillation, the atria up here decides to go their own way. And they don't play nice anymore with the bottom guys. They're up there quivering. And because they aren't doing real squeezing and clean pumping, tight pumping, then blood can kind of circle around the edge of the atria, and that can form clots. And then on a good squeeze, it can send a clot up to your brain. Most strokes are from that, an embolic stroke. About 13% of other strokes are from a bleed of an aneurysm or a AV malformation, a weakness in a blood vessel. And those, especially if you have high blood pressure and you have an aneurysm, that is a big problem. That's another good reason to keep your blood pressure under control. Because when that bursts, that body, your blood pressure is pumping blood into your brain in this closed system where there's no room for swelling, and that there's no room for your brain to swell out with that extra blood that's being pumped in there. The only thing left for the brain to do is to herniate in on itself. Strokes are as much a 911 emergency as heart attacks are. Every second that you get somebody closer to the ER for help with a stroke, you save brain cells.